So thanks for spending time with me today, Stefan. If you'd just like to touch on your profession, your credentials, and your clinic, it'd be really exciting for people to know about what you're doing.
Yeah, okay, my name's Dr. Stefan Billing. In this country, my primary registration falls under chiropractic, but I spent 13 years overseas studying neurology at Kensington College in London and at the Carrick Institute in Florida. Did a lot of my postgraduate or postdoctoral specialty work in Europe, brain dissections in Vallejo in California, and I've been, all around the planet, basically just trying to seek truths and trying to find out what works for people, cutting through the stuff that makes up professions and figuring out what's actually beneficial for patients, which means straddling a couple of different professions. So, I've got my primary registration is chiropractic, but postdoctoral studies in functional neurology, functional medicine, vestibular rehabilitation, mild traumatic brain injury. These are all areas that I've studied and come to realize that one of the biggest problems with brain injury and brain recovery is inflammation, brain inflammation, chronic issues causing systemic inflammation, which come down to lifestyle factors, dietary allergens, immune system dysregulation, and also the fact that autoimmune conditions play a massive part in brain health as well. So, as I said, I've been trying to seek these lines of truth and find out what it means, and that's guided my postdoctoral professional development, so that I have this skill set that I guess is a bit different to others, and therefore my viewpoint on how to treat brain and how to treat the whole person is much more eclectic, other than just what my profession says I can do. I do stuff in functional medicine, stuff in functional neurology, chiropractic work, physical therapies, lifestyle modification, dietary modification. These are the ways that you have to treat complex cases. You can't just put someone through a simple model and expect a complex case to recover. So that's me. It's like a spider web or a tesseract of different viewpoints, all coming together to fix someone. My clinic is in Wanaka. It's called the Koru Clinic, and we do functional neurology, functional medicine. We do American-based lab testing for getting information that needs a deeper dive into someone's health. We do dietary antigen testing, immune system testing, organic acid testing, microbiome assessments, gut health functions, hormones, all sorts of things. We just, when you're looking to fix someone that's had a complex problem, it's this whole raft of investigations to get to the root cause of the problem. But we run rehab programs for people who, like yourself, were struggling to recover from concussion or brain injury or inflammation, and you have to look at the whole person from multiple avenues to figure out, what do we need to put back together to rebuild this person's physiology and therefore help their brain to function.
Yep, that's I guess with the document you're going to show me through, there's some concussion recovery strategies that they've been using. Do you want to touch on a couple of the key ones that you find the most helpful for chronic issues with concussion?
Yeah, so one of the factors that I would say that's come across on all of the post-concussion syndrome patients that I've dealt with is that within the current model for concussion recovery is that the neuroinflammation is not really addressed, and the influences on neurological inflammation are not really addressed. So like your brain has specialized immune tissue called microglia, and your brain's environment is separate to your body's environment. And so your body has its blood-based white blood cells, and your brain has microglia, and in between the two of them is this specialized barrier called the blood-brain barrier. And if this barrier system opens up, your white blood cells want to enter the brain environment, and then the microglia says, hey, get out of here. And now you've got a war between your body's immune system and your brain's immune system. And that creates like severe neurological inflammation, even neurological autoimmune inflammation. And so one of the factors that I've found that isn't addressed in a lot of the people that have these problems with post-concussion syndrome is that no one's looking at the blood-brain barrier, and it's like it's literally this specialized immune tissue that wraps around the blood vessels. So the brain determines what comes into the brain environment. It wants oxygen, it wants glucose, it wants nutrients, but it doesn't want all the other stuff that's carried around by the bloodstream. And so, some of the nutraceutical protocols that Tess has come up with and that I've recommended and that yourself have taken is to first and foremost address the fact that the blood-brain barrier needs to close. The brain needs to reestablish its internal environment for its biochemistry, because the brain's neurons don't work well in the body's biochemistry level. The brain has to pump all of that stuff out so it can create the environment so the neurons can work properly. So that was what I would say would be the biggest overlooked component in post-concussion syndrome. But as far as concussion recovery strategies, we're going to have a chat about 7 different really simple at-home things that people can do to help get their concussion back in the box and start the process of addressing all of the factors that influence reason why concussion is slow or refuses to recover. And so the first one of that I've found, and I have one of these in my own practice, is oxygen. Hyperbaric oxygen therapy is unfortunately not subsidized or covered by ACC, but there's a lot of them in the country now, and I think somewhere people would be able to get access to it, whether they borrow it from a friend or they find a practice that has it. But hyperbaric oxygen therapy just loads up oxygen molecules onto the hemoglobin and uses pressure to get it past the constriction. So inflammation causes blood vessels to get narrow, and if the blood vessels in the brain are narrow, then you're not getting oxygen to the damaged tissues, and so they're not going to metabolically be able to heal and recover. So I think getting oxygen into the brain is really important. And oxygen under pressure, it's about 95, 97% oxygen at about between 1.3 and 1.7 atmospheres of pressure. So it's you just hop in it, lay down, have a 90-minute nap a couple of times a week, and that helps load up the body with some oxygen so it can heal.
Awesome. Do you want to go on to number 2 with the block blue light?
Yeah, so our brain is so overwhelmed these days with stimulus from screens. I mean, there's all of the screens put out blue light, and blue light, like the blue sky, stimulates your brain and tells it that it's daytime. But how many of us sit in front of a computer or a tablet or an iPhone or even a TV at nighttime, and we're stimulating our brain with blue light, which if it messes up melatonin. And one of the main things that your body needs to do after a brain injury is it needs to sleep and recover and heal. It needs to save energy, because healing a brain and healing axons that have been stretched and damaged and twisted uses a massive amount of energy. And the one thing that shuts down during the first stages of a concussion is that your mitochondria in your cells are not working well. And so your neurons are in an energy deficit. And so that's why people sleep a lot. The brain needs to switch off, rest, recover. And, all this scrolling on screens and TikToks and shorts and videos and, all that time in front of screens just massively messes up your melatonin, your sleep hormones. And the blue light is telling your brain that it should be awake instead of asleep. So, one of the simplest rules is that no phones in the bedroom ever. Your phone should be left out of the bedroom so that the bedroom is dark and it's a sleep environment. But yeah, you can filter out blue light. You can wear yellow lenses or orange lenses, but you can filter out blue light. Helps massively, and you just follow some simple, sleep health rules where you're strict with the fact that bed and bedrooms for sleep, and phones, blue lights, TVs, and all those other things are just not in that environment.
Primo. With the number one, follow an anti-inflammatory diet. Do you have a most commonly used diet that you provide for clients, or?
Yeah, I mean, we do dietary allergen testing, and a lot of people have IgE and IgG overstimulation, which people have heard about mast cell overactivation, histamine sensitivity, all of this stuff post-COVID, where people are talking about their immune systems a bit all over the show. It's reactive, and they take longer to recover, or they're catching everything that's going. But anti-inflammatory functions start with diet. The one thing that we do regularly is we put food in our mouths, and a lot of people have food allergens, but some of the worst and most common ones are gluten sensitivities and dairy, cross-reactivities, pro-inflammatory diets, and the white poison. Sugar is such an inflammatory trigger, not just for the brain, but for the body, and it messes up glucose regulation and causes insulin sensitivity. And the brain uses a massive amount of glucose. It uses about 25% of the oxygen in your body and about 30% of the glucose. Like, your brain's this really fuel-hungry machine that needs oxygen and glucose to run it. And so a pro-inflammatory diet is another reason why post-concussion syndrome and slow recoveries from concussion occur, is because you've got to get the inflammation down. Like, one of the main things about an anti-inflammatory diet is that sugar feeds the bad guys in your gut. Sugar feeds candida and the bad bacteria. And so you can start to get dysbiosis in the gut, which messes up neurotransmitters. There's this whole relationship between gut health and brain health. And the good bacteria help to produce things like serotonin and dopamine. And we need those neurotransmitters for brain health. And they can be shut down when there's dysbiosis in the gut. The other thing that can happen is that you can become nutrient deficient. You can have blood sugar imbalances. And all of this just winds up the immune system. I talk about the immune system being like a tide, high tide and low tide. And when it's at low tide, it's tolerant of the environment, and it's tolerant of your own tissues, and it tolerates the food that you're eating. But after a prolonged period of being inflamed, it's like the tide slowly increasing until it's now, too much inflammation, and your body's immune system just becomes intolerant, and it attacks your tissues. It reacts to the environment. Your seasonal allergies, your animal and cat or dog allergies get worse. You start reacting to more and more foods. They're all just warning signs that your immune system is in overdrive.
That's interesting. So you have a lot of success from the initial testing in a short period when people have these allergies.
Yeah, I mean, once people are done the testing, it's like the difference between wandering around a city looking for your destination and having a roadmap. It's like, once you've done the lab testing, it's like, well, you need to cut out this, and this, and your immune system's going to reset relatively quickly. The nutraceuticals that help close blood-brain barrier, and then dietary allergen avoidance, and calming down the immune system through avoidance of pro-inflammatory foods. Like, literally, people, I've had a patient, I remember, teleconsultation, just putting our protocol in place. There's a woman on a teleconsult like this, could not sit still, was shaking, just was having a rough time. 3 weeks on the protocol, we had another consultation. I couldn't believe it was the same person, and all we did was get her inflammation down. So it's a massive component. And this document that people can get has 9 tips for following a good anti-inflammatory diet. So that's certainly something that they can read up on when they download it or it gets emailed to them. But there's really simple things that you can do and add into your life on a daily basis. You change 1 or 2 things, avoid the things that cause inflammation, and your brain starts to recover.
Yeah, I hadn't heard about the importance of reducing inflammation until I met Greg. So, and then to following your protocol since then and using hyperbaric chamber, I've really recognized the improvement in my, I suppose, thinking and the less fogginess I've experienced.
The brain fog, yeah. Brain fog is literally your brain's interpretation of an inflammation response. Like the brain doesn't have any pain receptors, but when it's inflamed and there's poor metabolic function, the greater your inflammation, the greater the brain fog. And so, people do notice that, they eat a certain meal and they've got brain fog, or they, drink alcohol and it affects them way easier. 2 beers and all of a sudden they're got a horrific hangover, and, they eat specific foods and their brain fog shows up. That's just your immune system reacting to what you're putting into your body, and then that having an effect on cognitive performance.
That's with the brain nutraceuticals, there's a few supplements listed. Do you want to touch on a little bit of detail of each of them and why they're important?
Yeah, I mean, glutathione is an antioxidant, and liposomal glutathione can cross the oral lingual mucosa and get into the brain much faster than, say, if you're swallowing things into the stomach. So glutathione is the big brother of the other antioxidant, vitamin C, and it's basically trying to protect your cells and prevent inflammation in the body. Glutathione is recycled, so as your toxins go out through the body and out through the kidneys, it's recycled, but it can begin to get depleted because glutathione gets replaced with N-acetylcysteine, and so glutathione depletion, vitamin C depletion leads to toxicity, where people are just not, their organs aren't working right, the cells aren't working right because they can't get rid of all the inflammation in the body. Resveratrol's another neuro anti-inflammatory. It really makes a massive difference. I think resveratrol was in the product called Cytoquel. So like some of the products that are listed here are generics, and then others are specific because this is in the USA, but we do actually have the New Zealand-based variants of them. So resveratrols are really important. Vitamin D is massively important. Vitamin D and brain health and immune health is integrally tied into each other. Something to dampen neuroinflammation. Again, that product that you've taken is called Cytoquel. The Neuro O2 that helps supply the brain with more oxygen and nutrients. It'll have compounds in it that people have heard of, like ginkgo biloba and other things that cause vasodilation and increasing oxygen delivery. Products that help with gut health, liver and detoxification, B vitamins, antioxidants, immune health, and metabolic function. We tailorize these to people based on what their body's needs are, and that's again why we do some lab testing to make sure that we're not guessing. We test and we give you what your body is needing. So yeah, there's a very specific protocol. I think the one that you went on, it's 7 items, and it's basically addressing everything that you need to just help your brain get past the inflammation stage and start recovery.
Yeah, it's there's a big barrier for learning and being educated when you've had a concussion. I mean, how can people find out this information if they're just going through the ACC sort of pathway? I guess.
Yeah, I'm not sure that they would get the functional medicine support through an ACC pathways. They're not the, I think the influence and the importance of all these lifestyle factors into the small minority of people who don't recover in that time frame. I think it is where it sort of falls into the next level speciality of people that can find out why someone's not recovered, like most people who have a mild traumatic brain injury or concussion. As I said, within 2, 4, maybe slightly longer, 6 weeks, they should be pretty much right. But that 15%, 20% of people that don't, I think there's a safety net there, not catching them. So I think that it's becoming more well known, and I think people are getting this information perhaps from outside New Zealand shores, like yourself. You're sort of finding out that, okay, outside of the New Zealand healthcare system, that there are plans and strategies and protocols to follow. And yeah, I just think that being able to do something yourself at home is important, and there are some simple exercises that people can do that does help get their brain out of this flight or fight state, which concussion does leave people in a state of sort of anxiety, or the brain fog makes you feel stressed. One of these easiest self-hack things you can do is stimulate your vagus nerve. So our body should be run by the vagal system, which is a rest and digest, versus the flight or fight system. And so when the brain is not working well, neurotransmitters are down, oxygen's down, glucose are down. Perhaps eating the wrong things, drinking alcohol. All of these things just compound the issue. But the vagus nerve is needed to help calm the brain down, because the flight or fight system will start driving the system up and up and up and up. So you can do gag reflexes. You can, listen to specific noises that are calming. Meditation does help as well, as we've just talked about, a descending modulation of the flight or fight system. But one of the simplest ways to activate the vagus nerve is gargling. And I always tell my patients to do this in the shower. The last 90 seconds of your shower, switch it to hard cold. It's like, those ice bath things that they used to do. And so while it's on hard cold, you're getting that sort of, that ice bath shock to the system. But fill your mouth with water and then gargle. Like, make big, messy gargling. Doesn't matter, you're in the shower anyway. But keep filling the mouth with water. So you're putting your mouth open, water's filling it up, and you're changing the pitch, high, low, high, low. Make silly noises. If you end up laughing, that's even better, because you'll release endorphins as well. But that gargling response and the throat response really stimulates the vagus nerve. There's another thing that you can do when you're brushing your teeth. Flip your toothbrush around and use the smooth edge to stroke the back of the pharynx. And what you're trying to do is create a gag response. And now you don't want to do that so many times that you feel like you're going to throw up, but about every 5 to 10 seconds, you want to stroke the back of the throat until you get like a gagging response. That gag reflex strongly activates the vagus. And deep breathing exercises that A, improves oxygenation, B, calms down that flight or fight response, but it actually also calms down your stress response. It helps control heart rate, lower blood pressure, and increase oxygen. And these are all things that you need to get up there into the brain.
So how does the vagus nerve actually control your organs and the functioning of them?
So the vagus nerve is a parasympathetic activator, which means that it is an inhibitor. The way that your body system's designed is that everything is kept active but switched off. So that's not the right way. It's kept active but calmed down until you need it. and then the suppression is removed, and then the activation releases it. And so things like heart rate, like babies are born with heart rates, 180, 200. And as they mature, their vagus nerve matures and actively slows the heart down. And so a resting heart rate of, say, 55 or 60 beats per minute is because the vagus nerve is telling the heart to slow down. And so same thing when it comes to, dilation of blood vessels. Vagus causes dilation of blood vessels. Sympathetic nervous system causes constriction, tighter. And so the vagus nerve is this big long nerve that runs down inside the gut, and it touches on everything. And its job is to control the timing and activation of, heart rate, breathing, gut motility, releasing pancreatic enzymes and gallbladder and kidney function. And so the vagus comes down the neck and into the abdominal cavity, and then the flight or fight system, the sympathetic nervous system, runs down inside the spinal cord, comes out at each level of the spinal cord. And so you've got this inhibition and then activation. So that inhibition has to switch off, and the activation then switches on the organ. And then when that organ's done its job, the inhibition comes back on, and that basically puts it back in its box and says, okay, we need you in 12 more hours. You can stay switched off until we need you again. So it's called the master controller of the body, because it controls everything through this active inhibition, switching on, switching off when you need those organs to function.
That's
really
cool.
Vagus is very, very important. But it also helps with the dilation of blood, increases blood flow to the brain. So the vagus nerve helps with concussion because it, increases blood flow to the brain, and it also switches off that, that flight or fight response, which can then cause anxiety and stress, and that whole wind up where the brain just gets all too anxious and too overstimulated.
So what is it about a concussion that can knock the vagus nerve out of sort of system or sync?
Well, it's a couple of things. Like the way that the sympathetic and parasympathetic nervous system works is that we should be, the numbers change a bit, but we should be, say, 90% parasympathetically run with the occasional 10% sympathetic. And so the rest and digest system is dominant over the flight or fight system. So the vagus keeps the flight or fight system suppressed until we need to run away from a bear, and then the reverse happens. But then as soon as we've run away from the bear, the parasympathetic system keeps the sympathetic system suppressed. So after a head injury, over time, if the vagus isn't keeping it suppressed, when the cat's away, the mice will play. So the sympathetic system winds up until it's the dominant system. And so when the sympathetic system is working too much, it has wide-ranging effects. It communicates directly to the limbic system, which is where our emotion centers are. And so we can have all sorts of, emotions and changes in our baseline level of function. And often in a concussion, the other part of the brain that's affected is the frontal lobes. Frontal cortex gets banged around because, the brain sort of wobbles inside the head. And the frontal cortex keeps the limbic system in check. When you're starting to worry about things too much, it's the frontal lobes that say, no, we thought about that. That's not going to happen. Don't worry about it. And so without that happening, these things start to ruminate, and they start going over and over and over. And the more we think about things, the more anxious we get. And the more anxious we get, the more the flight or fight system ramps up. And the more the flight or fight system ramps up, the more stress hormones we release. And that further shuts down the brain and the blood flow. And it's this terrible cycle that just keeps happening to people. And so we've got to get that sympathetic dominant system back in its box and get the parasympathetic system active again. And so that's why vagal stimulation is so important.
That's super interesting. Do you want to touch on what you spoke to me about before with the rats and the different hemispheres and having an
Oh,
imbalance?
yeah. The asymmetry of brain function. Yeah. So there's deep structures in the brain called the basal ganglia. They do two things. They're a pacemaker. They keep each hemisphere in time with each other. So I described it as like a hamster on a wheel. You've seen a rat or a hamster in a cage. They get on their exercise wheel. And so imagine you've got two of these things running at the same speed. If they're running at the same speed, the hemispheres work together. But after a concussion, the basal ganglia can get out of time with each other. And one side can be depressed, not depression, but depressed function. And the other side can get unregulated, or if the frontal lobe's been affected, it not inhibiting it. So one side can get overstimulated and the other side's understimulated. So you get this asymmetry of brain function. Now, it's not bipolar or schizophrenia. It's just functionally one side's stuck and go and the other side's on slow. And so when you get this hemisphericity or this asymmetrical brain function, people they struggle. They really struggle to do even basic tasks. And what happens is that the side that's overstimulated runs out of resources, oxygen and glucose, and then it crashes. And then this side can kind of run the show. And then as this side comes back online, for a short period of time, they're at the same operating level. And then this side is going back up to its hyperkinetic state, where it's, the hamster's running faster and faster and faster. And so it's really exhausting to have a brain that's kind of doing this all the time, And so part of the rehab that we do at Koru Clinic is that we address the fact that there's these deeper structures that run the timing and the filter and the functions of the brain called the basal ganglia. And we retime those so that the two hemispheres can work together again. But before we can do any of that functional neurology rehabilitation, we've got to get the neuroinflammation under control. We've got to get, the brain's blood-brain barrier working properly so that the brain can recreate its own environment, get the inflammation down systemically, not just in the brain, but get the neuroinflammation down as well as the systemic body inflammation, get the gut health working properly, and then, the brain can get back into that recovery mode. Like the body's a self-healing machine unless it's being disrupted. And for mild traumatic brain injuries and concussions, the people that have post-concussion syndrome or they have really prolonged and difficult concussion recovery, I haven't met a patient yet that doesn't have some of these things that we've been talking about, either after the concussion or pre-existing to the concussion. So you ask a question of, how can you predict which patients are going to recover easily and which ones are going to struggle with their recovery? Then, those are probably some of the key factors, lifestyle and dietary factors, inflammation in the body, blood-brain barrier disruption, all these pre-existing gut health issues that will affect their brain's ability to recover. So the patients that I come across that find me and sort of say, hey, I've had an injury and my brain's not getting better, that's why we look at all of these other systems that support the brain and sort them out first, while we then help the brain reduce the inflammation and recreate its internal biochemistry environment, by getting that blood-brain barrier working properly. And then slowly the brain sort of says, okay, I'm going back to where I work up here, not what the body's telling me. The neurons don't work well in an environment that, say, your muscle cells work in. They're quite different biochemistry environments.
Awesome. Without sort of recalibrating the systems that you're talking about, is it very likely for these people to come right from chronic long-term concussion problems, or what could it lead to if that's not been?
Yeah, well, I mean, people that have post-concussion syndrome for many, many years, it wears them down. It gets to them. And I think this is possibly part of the reason why we're having this discussion is because, you know, Billy perhaps had an undiagnosed issue that just led to changes in biochemistry and neurotransmitters, you know, serotonin, dopamine levels all being mismatched, and then people can fall into hopelessness. I think one of the big things about internationally is that the word that's thrown around a lot is hope. You know, we help people find hope or give them hope back, because a lot of people have had symptoms for quite a long time and just don't feel heard.